Bismillahirrahmanirrahim. A 21-year-old woman is brought to the emergency department due to continuous vomiting, diarrhea, and high fever for a day. The patient also has severe headache unrevealed by acetaminophen. She has no hematemesis or hematochezia. She returned yesterday on an international flight after spending the last 3 months in Southeast Asia. She has no chronic medical condition or prior surgeries. The patient is sexually active and uses oral contraceptive pills. She is currently on third day of her menstrual period. The patient does not use tobacco, alcohol, or illicit drug. Temperature is 39, blood pressure is 80/40, and pulse is 124 per minute. Physical examination show a diaphoretic woman with dry mucous membrane. There is no nuchal rigidity. An erythematous macular rash cover the entire body, including the palms and soles. Which of the following is the most likely microorganism responsible for these symptoms? Epstein-Barr virus, herpes simplex virus type 2, Neisseria gonorrhea, rotavirus, Shigella, Staphylococcus aureus, and Treponema pallidum. So this patient is 21-year-old woman having continuous vomiting with diarrhea and high-grade fever with severe headache that is not unrelieved by acetaminophen. She is sexually active and uses oral contraceptive pill. She is day 3 of her menses of her menstrual period. Her temperature is 39, blood pressure is 80/40, and pulse rate is 124 per minute. On examination, show a diaphoretic woman with dry mucous membrane. There is erythematous macular rash on entire body, including the palms and sole. So here the diagnosis of this question is toxic shock syndrome, TSS. So diagnosis of this question is toxic shock syndrome, and here the correct option is choice F, Staphylococcus aureus. Here the most and the more important hint in this question is only this one. This is that she is currently on third day of her menstrual period. This is the most important hint in this question, which will go toward the diagnosis of this question, because this patient is using tampon from the last 3 days. So on menstrual women, the most common cause of toxic shock syndrome, which is caused by the Staphylococcus aureus antigen, which act as a super antigen. So why the choice F is the correct one, Staphylococcus aureus? Because this patient has toxic shock syndrome, which typically present with high-grade fever, hypotension, and a diffuse red macular rash involving the palms and sole, as this patient is suffering from. Other clinical manifestation of toxic shock syndrome include headache, vomiting, profuse diarrhea, and mucous membrane hyperemia or ulceration. Desquamation of the palms and soles occur 1 to 3 weeks after disease onset. Menstrual causes of toxic shock syndrome are caused by Staphylococcus aureus infection related to prolonged or continuous tampon use. Disease occur due to the release of toxic shock syndrome toxin 1, an exotoxin that acts as a super antigen, causing an exaggerated immune response leading to shock and multi-organ failure. Treatment include massive fluid replacement, antibiotic therapy, and removal of the foreign body. Come to the incorrect one, Epstein-Barr virus. So Epstein-Barr virus causes infectious mononucleosis like symptom, that is, for example, high-grade fever, malaise, headache, pharyngitis, and cervical lymphadenopathy. Choice B, herpes simplex virus type 2. So herpes simplex virus type 2 can cause meningitis, which typically present with headache, photophobia, and ulcerative vesicular genital lesion. Choice C, Neisseria gonorrhea. So disseminated gonococcal infection caused by Neisseria gonorrhea can present with pustular rather than macular dermatitis. Patients also typically have associated synovitis and migratory asymmetric polyarthralgias. Choice D, rotavirus. So rotavirus, which is known as traveler diarrhea, cause a mild viral gastroenteritis with watery diarrhea and adult. There is no associated rash. Choice E, Shigella. So Shigella virus causes bloody diarrhea. Patient with Shigella causes gastroenteritis, having fever, bloody diarrhea, and abdominal cramping. There is no associated rash. Choice G, Treponema pallidum, which is secondary syphilis caused by Treponema pallidum, may manifest with a maculopapillary rash involving the hand and soles. However, patients typically have indolent rather than acute presentation.